I'll get started then. So yeah, so hi, my name's Michael Parker, and I'm a research officer and data scientist with the Centre for Population Health. And yeah, so I've been working on a project called CareLink for 18 months, 18 or so months now, and we've been trying to incorporate this method, which I'm going to tell you about today, which is synthetic control models. And it's really interesting. It is, yeah, relatively new, particularly in trying to incorporate it into healthcare data. So I'm going to try to give you an overview of that, and also an overview of how I'm trying to implement it as well. And there'll be some other little bits in there as well. So we're just going to cover what is the synthetic control method, how does it work at a very, very high level. We're going to talk through sort of a series of examples, the basics of applying it in R. So I give an example of how to apply it in R Studio. There are other ways of doing it, but that's how I've done it. Even within R, there's multiple different ways of doing it. The advantages and limitations of the method, further applications, so my applications of it as well. And then there is a little quiz, which while it's there for fun, it's also going to help me evaluate if I'm covering all the points that I need to hit in this, and it'll be good feedback for me for this presentation. So what is the synthetic control method or synthetic control modeling? So I've actually just popped in this figure here because this is sort of the core output that you get from synthetic control modeling in the state that I'm going to be teaching it, which sort of demonstrates to us at the point an intervention. So that at its core, synthetic control modeling lets us evaluate the effect of an intervention. So in this example, we have cigarette sales over a 30-year span, and we have an intervention in 1988. And we can see that in the observed, we keep going down. So cigarette sales, so in the observed is where our intervention has occurred, and we continue to decline in cigarette sales. Whereas in this synthetic line, it doesn't decline quite as quickly. It sort of continues to decline in the sort of normal way, in the normal pattern the data was presenting before the intervention, which suggests at surface level that the intervention is effective. Now we'll revisit this after I've explained synthetic control modeling, and hopefully it'll make a little bit more sense when we come back around to it. So we'll go back to the beginning. What is the synthetic control method? So it's a methodology classically designed for testing large-scale interventions. So as the example I gave there was an intervention, something like a cigarette tax or a cigarette ban or something that is going to reduce the sale of cigarettes. But it's not limited to things like that. It doesn't necessarily have to be an intervention, just something that happened at the same time to potentially a large group of people. So on a nation level or nation scale, something like investigating the effect of a conflict on a country's economy. It tests the counterfactual. So this works in both directions. You can either test what would have happened if the intervention hadn't occurred, or what would have happened if the conflict hadn't occurred, but you also test what happens if you apply an intervention. So if you apply a cigarette tax in only one place, like California, and in no other states, does that cigarette tax actually reduce cigarette sales? Does it actually increase the health of the population? And it depends what you're measuring, but you can test it in either direction. But what you need is one case where it has or hasn't happened, and then you need a collection of control units where the opposite has occurred. So the overall idea of how it works is it uses those control units where the opposite effect has happened, and the maths basically weights an optimal synthetic unit using those to make a comparable unit. So it's a bit like matching, but instead of matching against something that is real, it sort of zombifies a bunch of other units to make one perfect synthetic control unit. And the weights are picked based on the pre-intervention period. So if we just go back one slide, the weights are based on everything left of this intervention line, so that when we're observing the effect, we're not observing any of the maths that we put in. We're just observing the pure modeling that's going on. So it borrows ideas from other techniques. Like I said, matching. There's a method called difference in differences, which are all sort of tools in your toolkit for analyzing and looking at public health, any intervention or any sort of effect. But it is distinct, but it does borrow ideas. And it has been sort of around for a while. So there's papers from as early as 2003 that looks at it. But it's sort of constantly being developed. There's additions being added. There's R packages, there's Python packages, and it's been applied to sort of a number of different outcomes that have been studied. And I'm sure, and it's sure it's going to gain even more traction, and it's going to keep being used in more places as well. So just as a comparison, just to make sure that we're all familiar with the idea, and just to compare it to the other methods that I mentioned, matching is almost like when you've got your data, you want to find a control or a twin of a person, and you do it directly based on their characteristics. So you might have a child who is a boy and lives in a certain area and got certain grades in school, and you want to find an exact person that is also has those characteristics, and that would be a matched a matched individual, and you could roll propensity matching into that as well, so you can propensity match using different characteristics as well. Difference in differences looks at the treatment effects, and it sort of assumes that the treatment and control would have changed the same without the intervention. So you're almost assuming that the group, that is what it says, that if that group hadn't received the intervention, the change would have been the same. So yeah. And then synthetic control modeling is build me a twin and mix up multiple people and sort of zombify them so they all look just like my case unit. And that way you have almost, in an ideal world where the method works properly, a perfect match that you can study your outcome on, so that there's no differences. And the example I give for this, which I think is a good anecdotal example, is imagine you were looking at children going into care, and you've got a bunch of cases of children who did go into care, and you're trying to find a control for them. So it would be unfair to say that a fair control is a normal child in the general population, because they haven't gone into care, so their situation isn't the same. So if you were to go further and find somebody with a really, really similar home situation, but they didn't go into care, you're getting closer to the point, but they still didn't go into care. So there's still something different that we can't identify within the data or within their personal lives or characteristics that led that one child to going into care. So by virtue of the other child not going into care, they're not a truly fair comparison. So by using SCM, we're making a fake synthetic twin that is, in an ideal world, the perfect match. So how does it work? So it uses these donors, these untreated units, and you create the synthetic control unit that is highly comparable. And to do this, they're weighted based on the pre-treatment outcomes. We use variables to predict the outcome. So variables for the controls are used to predict the outcome. So if it is children going into care, you might take their gender, you may take their anything, the amount of healthcare appointments they had, other information about their parents, and it's all utilized in this mathematical model to weight them and produce the synthetic unit. Weights are calculated using an optimization problem where you solve for the weights, and the objective is to minimize the difference between your two units. So unlike sort of classical statistics or models, regression models, there's no sort of like widely available statistical testing at the minute. So it's not that necessarily that easy to sort of factually say, oh yeah, the p-value is less than this, so we have a working model and we can say this for sure. But there is ways of intuitively sort of understanding whether or not your model is working, and this is done using placebos, and I'll explain what placebos are now. So the placebo tests, this works by testing the other units, the donor units. So if we were going back to our example with California and the smoking tax, we might use Texas, and we run the model on Texas. And what this does is if we then see a treatment effect in Texas where we know there was no tax implemented, then we know there might be an issue with the model. Whereas if we see that in our case unit in California, there was a substantial difference between the a substantial difference when we in the treatment effect when we run the model to all the placebos, we know there's probably a credible treatment effect there, and we can more safely say that the intervention actually had an impact. So overfitting, there is also an issue with this. So if you're familiar with sort of predictive modeling where you might overfit a model, so it predicts the data you've taught it on perfectly, but actually it's like wider, how much more widely applicable it is difficult to sort of determine, or it is poor. But it does present slightly differently in synthetic control modeling, where if you don't have sufficient data or there isn't sufficiently good control units, it may fit the underlying data when it's doing the modeling. It may not predict the outcome very well, and or it might be utilizing one of the case units too strongly. So it might be just fitting the trend observed in Texas, for example, rather than building a good synthetic model. And it may be the case, and this is something to evaluate, that Texas might be a perfect match for California now, but then thinking about it in the real world, it probably isn't. And all you have to do is look at some of the sort of surrounding information to see that they're probably not quite similar places. But all this sort of intuition helps you decide whether or not you're building a good or bad model. So we'll come to our example, and hopefully then this will bring together everything I've spoken about so far and help you understand it even better. So we'll talk about the example of smoking reduction through policy, which is the graph we saw at the start. And we'll ask the question, does the implementation of an increased cigarette tax lead to a reduction in cigarette sales? And so we need to establish all the different pieces we need of information we need to be able to evaluate this. So we need a case unit. So this occurred in California in 1988, according to this data. And we need multiple control units where the intervention did not happen. So we have other US states for that. And then we need a series of time varied predictors and our outcome. So as you can see here, there is sort of a bit of a model where we can see cigarette sales is our outcome, and we can predict that with, say, mean income for each state in each year, cigarette prices, and then mean population age. So what we need to do is we need to match the pre-intervention period based on these predictors, based on the different US states, and close that pre-intervention period as small as possible. And our way of evaluating this is then we look at the post-intervention period, and we can determine if there's been a causal effect of that policy. So hopefully that sounds easy. It is. Maybe if it doesn't, it's not as bad as it sounds. And we'll come back to this plot now. So we have our pre-intervention period in the orange here, and we can see they're nice and closely matched. In an actual ideal world, you don't want them to be perfectly matched because it means they're probably overfitted. If we're plotting the synthetic and observed line, there's always going to be some sort of natural variation. So you don't want them to be perfectly plotted, or there's probably something wrong with the model. We have our post-intervention period in blue, so we can see this as we come to 1988, the two lines bifurcate, and then we have the synthetic unit in purple, which is our fake unit composed of our donors, and we have our observed unit. So going back to what I said at the start, we see that in California, the line continues to decline more aggressively than our synthetic unit. So what we can take from this is that the implementation in California of the smoking tax did reduce cigarette sales compared to the other US states where this didn't happen. Or it not necessarily compared to the other states, but if you hadn't implemented this smoking tax in California, this is what the trajectory would have looked like. It's important to make that distinction because what I actually just said was not quite correct, because obviously there's so many factors to consider that might influence the sales of cigarettes. So you've got to treat it as this is a synthetic California. So you only talk about California. You say if we hadn't implemented this smoking tax, the cigarette sales wouldn't have declined as aggressively as they did. So we should talk about when it's sort of appropriate to use SCM. So in this example that I'm showing you here, this is just a mocked up fake example of a variable of interest. And in this example, we can say this is probably a poor model. And you can tell that by the pre-intervention matching. So everything left of the red line is sort of, there is some degree of sort of following the trends, but they're not very well matched. And critically, at the intervention time, the 2 points aren't even in the same. The 2 lines are not even at the same points, and even though they then go on to bifurcate, it's quite maybe difficult to, for sure, say that there was a causal effect of this policy implementation or this intervention. When do we want to use it? Ideally, we use it when there's only a handful of treated units. Ideally, you have one treated unit. There are extensions to the methods now that allow you to handle multiple treated units, but easier if you just have one. You want rich pre-treatment data. I mean, you want rich data overall, but you want rich pre-treatment data because the model you're fitting needs to understand the underlying patterns in the data. Which if you say if you've got 10 years of data and you only use 5 or you only use 3 years, you may not be able to pick out those patterns very, very well, and you may not be sure that the data is matched very well. And then you want good richness of data. You want a good number of predictors for predicting your outcome, and you want to have plenty of sort of donor units available, but not too many. Too many can be a problem as well. And then no parallel trends. So parallel trends is an assumption in difference in differences, which is a different method, which I mentioned earlier. So a little bit of how to apply it. So actually just a practical walkthrough of applying it in R. So if you're not familiar with R, hopefully you'll be a little bit more familiar today. So this uses a package called TidySynth, which is how I've used is the methods or the package that I've used to apply it, and I think it's quite a nice intuitive way of doing it without having to sort of worry about the underlying maths too much. So you start by creating your synthetic control object here at the top of the screen. I'll just zoom in for you. And here you can establish all the sort of important parameters of your model. So we have the outcome, which in this case is cigarette sales. We have our units, which is the states. Time, so years, but if you were doing 6 months, or it could be days, it could be anything, whatever you choose to put in this time parameter here. Our intervention unit and our intervention time, so California and in 1988. Generating placebos is that generating the placebos test, which I mentioned earlier. Here we have our generation of predictors. So what we want to do is we want to generate predictors between 1980 and 1988. Here we're going to use the mean of the log income of each state, the retail price of cigarettes, and what they're calling youth here. So this is the proportion or the percentage of the population between 15 and 24 in any given year. So obviously you can think about how these might interact with our outcome. If income is higher, people have more disposable income to spend on cigarettes potentially. If the retail price is lower, then people may buy more cigarettes. Or if there is a higher proportion of younger individuals, if smoking is popular in young people, then cigarette prices will rise. Or if there's a lower proportion but a higher proportion of elderly people, then depending on how it interacts with the outcome. But you can see this is used in the 8 years prior to the pre-intervention to the intervention period. And then finally, we just have this generate weight to the bottom, which specifies our window to optimize in. So we have 18 years in this example of the time period in the pre-intervention period, and then we have some sort of optimization parameters, which we don't need to worry about too much. These are the default ones given. And then finally, there's a final function that you use, generate controls. So you pipe that onto this to generate the controls at the end. And then using some pipe magic from dplyr or dplyr, we can put all this together and generate our synthetic control model. And this is why this package is really great, because it performs a lot of the heavy lifting for you, and you don't have to worry about the maths too much behind it. The only addition that I would state here, and I think this is an interesting thing that tripped me up for quite a little while, is here. So as you see in this generate predictors, they've utilized the outcome to help in the prediction. So they used cigarette sales in 1975, 1980, and 1988. So the year of the intervention. And this person who wrote this package is one of the leading authors. They wrote the 2003 paper on this, and so you're allowed to do that as long as you don't use any of the outcome from after the intervention. So you're not using future data to predict future data. This is fine, but you do have to use this carefully. You don't want the outcome to predict the outcome too strongly. You don't want the only variables used in prediction to be the outcome itself, because then you're not really modeling anything. You can't guarantee that the previous performance of, say, cigarette sales is going to predict the future. It's a bit like in finance, when you have the share value of a share of a particular stock, where it may have gone up for the last 10 years, but that's no guarantee that it's going to continue going up. And that's why you can use this to help plotting the trends, but it shouldn't be relied on solely to produce your model. So to just talk about quickly some of the advantages and disadvantages. Hopefully you think it's simple and intuitive. Hopefully my explanation's been reasonable. If not, the implementation I think is quite simple to understand, particularly with TidySynth. I think it's quite easy to apply that yourself and understand how each function works. You don't have to worry about parallel assumption trends, and it can be good with a small number of units. So you may only need one, or you need one case unit, but you may only need 5 or 10 good control units. And again, that comes back around to good control units. The higher quality data and the more similar they are before you start building the model, the better. Some of the limitations are it is better with a longer sort of rich pre-treatment data. So the longer you have, the better, because you'll give the model more opportunity to sort of understand the underlying patterns. It doesn't generalize well to multiple staggered treatments, and there are methods to extend this. So you want everything to have occurred at the same time. And this comes back to often the context in which you're doing the study, where you need to know, oh, so this policy was implemented in the UK in a given year, but it was rolled out progressively, and that's important to know if you're trying to do this analysis. It's not easy to significance test. There are extensions for doing that. So a lot of it relies on sort of intuition. So I'll just talk a little bit now, just 5 minutes or so, about the applications that I've tried to use it in, and that is in my active project, which is CareLink. And the core question being is being taken into state care beneficial to the child? And as I mentioned earlier, there's a sort of high amount of importance here in making fair comparisons, because it's quite intuitive to say children who go into care do worse than children who don't. And you could look at that in any outcome in school, in future successes, but that isn't a fair comparison, because those children weren't taken into care, and they never were going to be taken into care. So their situation just couldn't have been as bad. In an ideal world, what you need to do is, how much worse does this child do than the same child if they hadn't been taken into care? And that's what synthetic control modeling, to an extent, allows us to measure. So I've attempted to apply that to some outcomes in this space, in the children in care space. However, it is sort of fraught with challenges. Data richness. There isn't that many variables to study that we have, say, 30 years of data. I don't think we have 30 years of data within SAIL, are not reliable, or variables that are coded for all children for that amount of time. children don't go into care all at the same time. So unlike a fixed policy intervention in a country, it happens at many different time points over the years. And also a big one, especially when using person level data, is anonymity. If we were to follow exactly the situation we have where one child is equivalent to, say, one state, not only would there be too much variance in the data, we can't retain anonymity because the plot would represent one child. So we have to do some work to handle that. But can it work? And I think it can, and I have had some success in applying it. So the question that I pose is, does not being taken into care at age 5 alter the mean number of emergency department attendances for the average looked after child? So what I did to achieve this was I took 200 children who went into care at age 5, and I took 2,000 controls that were matched and were born in the same years as our cases. Obviously, they didn't go into care, so they didn't need to be matched on that. And I aggregated those 2,000 children into 20 units. So there were 50 units, 50 children within each unit, and I took the average data every year for each of those children. And I ran the synthetic control method. And what it produced was a plot rather like this one on the right, where we see in our pre-intervention we have decent matching, and then by our post-intervention we get a bifurcation. And what it suggested was that children who went into care had fewer, or the average child that went into care had fewer emergency department visits each year in the follow-up than the same child who didn't go into care. So what it suggested was that actually for that child in a dire situation enough that they had to be taken into care, that it was a positive thing. It reduced harms to the child because they didn't have to go to the emergency department as much, and also it reduced expenditure, reduced the number of appointments that were being used, and all these types of things. So actually, for that child, going into care was at age 5 was beneficial to them. So I'm just talk about a couple of the useful tools. So obviously I've spoken a lot about TidySynth in R, which is the package that is all these figures are made in. In the top, we can actually, I've demonstrated some of the variable and control unit weightings. So you can actually see on the left here, we get to see that Utah, Montana, Nevada, and Colorado were more influential in producing the synthetic unit than many of the other states, and that's a realistic look, because I know I use Texas as an example quite a lot, but actually that's one that is nothing like California, and therefore will not see very much use. And you also get to see the variable weights as well, so you can see how important beer sales were in predicting the outcome. Retail price was important, and you can see there how the use of our cigarette sales in 1988 and 1975 were important, but not the most important. And that is a sort of a good, healthy way that the variable weight should look. And you can use all this information to help you determine if you've got a good model or not. And then in the bottom right here, we've got the differences in each state of the donor pool. So this is when we're testing the model on each of our donors to see if there's a treatment effect. And in purple, we have California. So we can see that is the lowest. So we've achieved the most treatment effect. And that, for the most part, they're all higher. There are some that are close. But if we were seeing some states that were lower or even really similar, more similar to these than California, we would be concerned that we're seeing a treatment effect in somewhere where there wasn't a treatment, or where we don't think there was. And that might require us to go back and look at the context and say, oh, there was actually a policy implementation that was similar in Nevada in a similar year that we didn't know about initially, and it would help you sort of investigate the issue and determine that you might need to remove that from your donor pool. Similarly, that might happen if you looked at your control units and said, oh, Utah is the only thing contributing to our synthetic unit. That then might be a red flag that you need to investigate Utah and say, well, why is it so similar? What are the reasons it's only using Utah as the control? Because you wouldn't assume that two different states were perfectly matched in an ideal world. So yeah, it's all useful, and there's so many more different tools from this package alone that allow you to investigate these types of things and build a sort of an idea of whether or not your model is strong or not. There's a number of other tools. So in R, there's Synth, a package called gsynth and orgsynth, scikit in Python, scikit-learn, and econml, all options. I've not used any of these other ones. Some of them are for older versions of R and things like that. So, but they do have different functionalities and different options to add to them. So I popped this QR code on the screen. I will also now pop this into here. And you can please fill out this quiz. Sorry, I haven't been monitoring the chat. I haven't been able to see it. And I'll look through those questions while we're doing the quiz.
So I don't know if you want to answer the questions that are in the chat.
Yeah, I see you've had a crack as well.
You might be able to give more detail.
Hopefully. So if they're at different points in the red line, sorry, I'm realizing that some of them are referencing now things that we've passed in the presentation.
So is this wrong? You are using the trend that you will get from real control people, real control states. Yeah.
Mm-hmm.
After the intervention. So the trend, and it's a mushed trend of them. Yeah. As in, it's not an individual state or an individual person. It's an averaged weighted of everything available to you. And the weighting is done by before the intervention, which type of traits made you more similar. Yeah, so in that case, which states mush together better to be more similar to the intervention state, or which characteristics of the person that makes you more likely to say be taken into care. Harmonize, brings the lines closer together, and then that weighting is applied after the intervention, but using the trend that is real for the real units mushed together.
Yeah, exactly. So yeah, it is a little bit. It took me a while to wrap my head around it, and I kept coming back and going, "Oh, I understand it now," and then thinking, "Oh no, I don't understand it." But yeah, that's pretty much it. So it's building a model before the red line, before the intervention occurs. Mushing the variables, building a vector of of the variable weights and the control unit weights, and then applying that to the mushed trend after to build this synthetic unit. And that way it is, yeah, so it's, yeah, like I said, it's sort of building a zombie unit of all the different states and applying that afterwards. If there are, if so, Nancy.
Hi.
Hi.
Thank you so much, Sinead, for your answers, and thank you, Michael, for the presentation. I just wanted to make sure that I got it right in terms of when we're building the control, the synthetic controls, we are using the characteristics of the people that receive the intervention to weight or make the weights. I mean, we're using them to create a matched control, like we're matching, basically. So I will have to, the intervention must have taken place, or I know the characteristics of the population that will receive the intervention, and I will use this as a reference to create my own control that my control will have to match this population in terms of all demographics and all other variables. So isn't that correct, that we use the population that will receive the intervention as the reference group to create our control?
So yeah, in a sense. So we have our reference group in this example, California, which, when we look at the observed line, is just the real data. That is what happened in real time. So I'll share again. So if we go back to, so in this example here, I'm just going to close this so I can see people's faces. In this example here, the observed grey line is the true, that is what happened in California over that 30-year span. In pink, it is in pink before it is the aggregated state, or the aggregated control units that are all mushed together. And in the pre-intervention period, it's the whole thing is being adjusted by the variable weights to make it as similar to fit the patterns of the outcome as the case.
But in order for us to build the units that make up the purple line, the synthetic line, we will have to have the characteristics of the observed line, because these are our reference in building.
Yeah, we have all the characteristics for all. For all units. So obviously only there's no like future prediction. This is all happening with data we have from the past.
Okay.
Does that answer the question? Sorry.
It does, but then now I wonder if me and Sid now agree. I mean, Sid, do you also feel like there is difference in how it is? I mean, what you said is in a way not similar to what I said, but they're both correct. I don't know if you can feel that.
So, no, say again.
So what you said is that, I mean, do you also agree that we use the population that received the intervention to create the control?
Yes,
before
absolutely.
Right? So
yes.
Can you please just say what you asked Michael before I did? Because I felt like that kind of confused my understanding a bit.
Oh, right. Sorry.
Sorry. No, sorry. It's all new, really.
Well, I was asking more about after the intervention part rather than before. After the intervention, the trend is real, if you know what I mean. It's based on real data of what happened to those who didn't get the intervention, but you're applying that trend to the synthetic group. You're making a synthetic group that are the same as your intervention just before the intervention started. So at that point, you then apply a real trend. Yeah?
Yeah, okay. Yeah.
So they have to be starting at the same point. Your synthetic group is at the same point before the intervention. And then it's from that point you apply this real trend of mushed real controls, right? Okay. But the real controls may, in reality, have started higher or be lower at that point. Yeah, you've made a synthetic control by mushing them together to and weighting them so they're at the same point as your intervention just before the intervention.
Yeah, they must have the same start point.
Yes. And then
Okay.
you put the trend that you saw on the controls, that sort of mushed trend, yes, an aggregated trend of all of them, and look what actually happened to them when they didn't have the intervention.
Yeah.
Yeah,
Yeah.
that's
Yeah,
my
yeah.
understanding.
Okay.
I'm just checking with Michael as well.
Yeah, no, I was just thinking about it now. I was thinking, so if you have a in the pre-intervention, you have the trend from California, and you're basically it's the model is deciding how much to weight each unit and how much to weight each variable in order to match that. And then once that has happened, the model is allowed to then do its thing in the post-intervention period. So, but by achieving that weighting, we have a matched intervention, a pre-intervention period, and then it can just be allowed to sort of do its thing on that post-intervention data. It applies the same to afterwards.
Yeah. Okay. Thank you so much.
Were there any other
Thank you,
questions? Sorry, I noticed that there were a few more in the chat. I can cover them. Or is that covered?
It was mostly me.
Because you need to be able to plot a continuous thing, your outcome needs to be a continuous thing. So you can't use this to say the person would die or the person would not die or the person would get a diagnosis of a condition or not. It has to be something that is continual. Is that right?
Yeah, so ideally it's something quantifiable and easily quantifiable, and also something present in a lot of people. One of the not issues necessarily, but things that I ran into when doing it with mean appointments, especially in the emergency department, is that most people don't have, let's say, so there's a skew there because 90% of kids don't ever go to the emergency department, or at least each year. So there's only but then you take a mean, and the mean is always above zero at least. So yeah, and there are extensions as well. There's potential in theory to say, if you were to build a prediction model, say logistic regression or some sort of regression model for a binary outcome, and you put in a time as a factor, you can get the prediction each year and then match. You do a synthetic control model on the prediction for each year of getting for each group. And that's a possible way to convert a binary outcome into synthetic modeling, but I haven't actually tried that, and I don't know about how feasible it actually is in reality. It's just an option.
Sorry, do you mean like an odds? So you would predict the odds?
Yeah, so you could use like the predict function in R, where you build a model where you have, say, the outcome is dying each year, and you identify the probability for each group that happens in each year, and then you can use your cases and your controls to find a way to run a synthetic control model on that probability of dying in a given year.
Yes, you can make it continuous.
So you sort of you conform it by using, but then you're starting to add quite a lot of steps to a method that's already quite convoluted, and you have to be able to make that interpretation of, is what I'm seeing, does that actually make any sense? Does it mean anything? And then you also need to find good predictors for the probability of dying for a group of people. What are those predictors at a state level, or do you have access to them? Because on its own, on its standalone, if you don't have any predictors to weight, it's just the value of the model. You're not going to be able to get that good pre-intervention matching that you need to guarantee the model works.
So it's basically something you wouldn't be able to randomize, something that you feel that you can't get a proper control for, because the fact that you've had this intervention puts you apart from everybody else. And it's something with generally a continuous outcome.
Yeah, I think that's fair to say.
Yeah. Okay.
Are there any further questions, or should we have a quick glance through the quiz?
I guess my only question would be, what are there doubters out there who are critical of this method beyond just the fact that it's new and there's not a lot of experience with it yet? And what are those criticisms?
I suppose I've not actively come across a super amount of doubters, because I think it's just really, it's observing trends that you're finding. I guess
I can just imagine it not sitting very well with medics.
It's black. I suppose it's black boxy in the sense that machine learning, like, you don't really like the maths is not straightforward, but it is all just weighting and trying to minimize the difference between two groups. But especially when you're applying it in the way I've applied it, say through an R package, it is a bit like, I've let it do its thing and I don't really know. And that's why it has classically been used in like large scale policy intervention, and why it is. I mean, it is harder to apply in that medical setting anyway, because you just don't have the same.
I saw it in predicting where would Britain be if it hadn't had Brexit. Yeah. And that was, this is, say Canada before Brexit was this far apart from Britain and Australia was this far apart. So I saw all the countries relative to Britain before Brexit and where they've gone now and where Britain is now. And they mushed all, so you could see all the countries, but then they also mushed the countries into the synthetic Britain. So Britain using the trends of the other countries, but taking it from where Britain was when it left Brexit. Yeah. And where would it have been? And it was quite a powerful thing when they showed it. You thought, ooh, because you could really see it, if you know what I mean. So visually, it was quite nice to see. So I think for policies, it is easy to see because you can map it against real controls and see what they were doing, and you can do your mushed control U with your country or whatever, and it's really easy to see it.
Yeah. Can I just ask one more thing? Sorry, that's occurred to me. You said sufficient data. How much data is sufficient data?
There's no, I wouldn't say there's a hard and fast rule for this. In what I'm trying to do it with, we're probably lacking data, but you want enough so that the model is, you could reliably say when you're observing it that you have there's a plotted trend there, and it's not just matching like 2 or 3 points. You want that
so
data.
You go on how the model looks rather than a number.
I think that's why it's so sort of intuitive, because you can just sort of see observationally, oh, that looks overfitted, or that matching is really poor, or the donors, the placebos are showing a treatment effect when they shouldn't. And like I said, there are extensions to sort of statistically prove things, but there are additions to this method, and I'm not sure where they are at current. So a lot of it is intuition. I think just the whole overall, I mentioned right at the start, it's sort of a tool in the toolkit for evaluating policy. It's not this is the gold star method where this is going to replace everything, or even in a clinical setting, you say, oh, well, it might work and we might be able to apply it to individuals, but a clinical control trial is still always going to be superior over to trying to attempt this. So it's just another tool in the kit, and like Sinead said, it can be a powerful tool in addition to showing how GDPs were for other countries. You can attempt to simulate a Britain and a synthetic Britain and show what happened.
I thought you explained it really well. And for me coming new to this, I really like the examples as well. That's what really helped. I ignored the R pages and I focused on the rest, and that was all good. So thank you, Michael.
No worries. The R pages, it's hard to take in R just from a presentation slide. So I don't think you're alone there. But we'll have a quick glance through the quiz, and we'll just look at the answers. So what is the main goal of synthetic control modeling? To clone the treatment group in a lab using CRISPR. So CRISPR is a gene cloning or editing technique, so it's not that one. To compare the treated unit with their identical twin from a parallel universe. Now, I wish it was that. It is unfortunately not that. To estimate the counterfactual outcome for a treated unit using the weighted combination of control units. 87% have put that. So I think that might be the correct answer, and it is. And it isn't to replace regression models with something cooler sounding, but I do also think it is cooler sounding as well. So well done for that one. So what is required to conduct the synthetic control method. So 12%, a collection of untreated comparison units and pre-treatment outcome data. So we definitely need that. We definitely need post-treatment data. We definitely need time-varying predictors to predict our outcome. So the answer is all of the above. So how are weights assigned to the donor pool units in synthetic control? Randomly, so nobody put randomly. By regression and comparing the outputs for each of the units. So this doesn't use regression. Like I said, this uses something called an optimization, or it solves an optimization problem. And it does this by minimizing the differences between the pre-treatment characteristics between the treated and synthetic units. Or between the treatment and synthetic unit, and then none of the above. So it should be answer C. Which of the following is a scenario where the synthetic control is most appropriate? So 100% have put one answer, and I forgot to hide it from the previous slide. But estimating the effect of a new drug using 10,000 patients in a randomized trial. So that is in a randomized trial. There's possibly ways you could conform this method in looking at drug implementation or effects, but it would require a lot of data management and handling, and not in a randomized controlled trial setting. So measuring the impact of a nationwide reform. So as I said frequently, this is really good at studying high-level policy implementation, forecasting future weather using machine learning. It's not that's machine learning, and future weather would be incredibly hard to predict with this method. We can't predict the future with this method anyway, and it isn't none of the above because it's B. And then question 5, what is the purpose of the placebo testing in synthetic control analysis? So to compare the true treatment effects to effects obtained when pretending other units were treated is 62%. To see if the donor units would have benefited from the treatment instead. To reduce the risk of overfitting the model, and none of the above. So the correct answer is with the majority. And if you remember what I said about the placebo testing, it was applying the model to a different state to see if we received a treatment effect or not. And if you did when there was no treatment, you have a concern with the model because you shouldn't see it. It isn't to see if the donor units would have benefited from the treatment. That would be almost doing the reverse method by applying the reverse method. And I suppose to be fair to the 25% who put to reduce overfitting, it is a component when you do this sort of analysis of seeing what the fit is like, but it's more to see if there's a concern with your placebos, and also to help you validate the model to see if the treatment effect you're seeing in California is unique to California, or if you're seeing it in other states as well. Because if you are seeing it in other states, then it probably isn't a true effect. So that is everything. That is the quiz.
Thank you.
Yeah.
Thanks a lot.
Thank you, Michael.
All right.
If there are any further questions, I can post my email in the chat and people can contact.
That would be brilliant. Thank you. Thanks. See you all.